The 5 most important things to know about recovering from radiation. One of them would be how long it takes overall to recover from whatever temporary side effects they may have. So, and it varies as to what side effects an individual man may experience. Some have none. But most people have a little bit of irritation of bowel or bladder or both, maybe a little fatigue. And it's always nice to know when that's going to get better. Mostly that gets better within 3 to 6 weeks after the external beam radiation is complete. If there is an element of fatigue, sometimes that lingers a little after that. But that's not usually the case. Normally people are pretty much back to where they were beforehand, 4 to 6 weeks later. Related to that, one element of the recovery that some men think about, a lot of the men that I work with are retired because that's the age group in which we more commonly see prostate cancer. Retired men like to take trips, and that's wonderful. Sometimes they want to take trips to places where there aren't a lot of bathrooms. And of course, on charter flights, there are long lineups for bathrooms. So sometimes I will say to people, just in case you have any sort of bathroom type of temporary side effects, bowel or bladder, and if you have any flexibility in when you might want to take your trip, you might as well leave at least a month after completing the external beam radiation, because then you're even more likely to enjoy your trip. Although if people say, well, I've already got my tickets booked and I'm leaving 10 days later, that's not a disaster. But, otherwise it's sometimes nicest to book your trip so that it's departing maybe at least a month after, because then you're sure most of the side effects have settled down. Other elements of the recovery. Now, sometimes what happens is that, in fact, we're not talking about recovery so much after the treatment, but sometimes there are issues that people set aside that they had initially that we come back to after, because the treatment is kind of job one, but yet the issue that was present beforehand remains. And what I'm talking about there is sexual functioning. And it is true over the longer haul, the sexual functioning can be affected by the radiation. Whichever the scenario is, baseline problems or issues that come along later, months or years after the radiation, one thing I want them to know before we go in is I really would like to come back to that discussion or talk about it now, if that is important to him. Some men it doesn't matter, but a lot of men aren't comfortable bringing it up. I mean, we in radiation oncology, treating prostate cancer, are an earthy bunch, and know a certain amount about these things, so we're more than happy to help with that, and ourselves, or make the necessary referrals as needed, or advise going back to the referring urologist. That's another option. So that would be another thing. I guess another thing about the recovery phase is sort of a longer term sort of survivorship question, and that is, mention to people, some men will develop longer term, potentially permanent side effects, changes in bowel or bladder that might need attention. And so part of thinking about recovery includes down the road knowing that they should report to one of their doctors, the urologist, family doctor, or us, whoever's kind of primarily involved in managing their survivorship care, any issues along that line, so that we can take a look at it and help with it and all that sort of thing. And I guess the final thing about the recovery phase, which I think is helpful to know, bearing in mind what I just said, is trying to get a sense of who to call. That's actually hard to know sometimes, because by the time people have completed radiation, they've often seen multiple people, sometimes multiple doctors at the cancer agency, certainly often a urologist, family doctor, and oftentimes they're not sure, well, who do I call? So it's not a bad idea before treatment's complete even, or if needs be, right at the first couple of appointments before the treatment starts, getting a sense of who to call later. And the advice we'll give on that will depend on where the man lives and kind of what the treatment was and, what we think the best follow-up plan is, all individualized according to the case and, of course, the patient's preference.